Hi, and welcome back to Student Nurses Success. Now, we've been covering a lot of the cardiac disorders, and we've divided them into smaller sections because the cardiac is so important to understand and know. This particular video is going to kind of wrap things up with just kind of these last bit of other cardiac disorders. Now, remember, you can find the link to the maps in the comment section. Let's go ahead and get started. Before we get going, let's just review a little bit of our anatomy. Here we have a nice picture of the heart, and it shows the layers of the heart. The endocardium, which is this inside layer of the heart, the myocardium, which is this middle layer of the heart or the muscle, and the pericardium, which is this tiny little outer layer of the heart. Those are the two things we're going to talk about here. Now, these layers of the heart can get inflamed. And when they do get inflamed, we do have some issues with that. The first thing we want to talk about is infective endocarditis. Infective endocarditis is the result of some type of infection that has settled inside the inner layer of the heart, the endocardium. This endocardium includes the valves and the inside layers of the ventricle and the atrium. And that will cause inflammation of the inside of the heart. Usually, the infection is caused by a staph infection, a strep infection, and sometimes even through IV drug use. Obviously, IV drug users are not always concerned with aseptic technique, and so that is going to increase their risk of developing infective endocarditis. Now, we also know those with prosthetic heart valves who have had them replaced for whatever reason are at also higher risk of getting an infection in that endocardium. In those particular cases, individuals who do have valves, we do something called SBE prophylaxis, that's subacute bacterial endocarditis prophylaxis. In these particular cases, they will take antibiotics prophylactically if they're going to have some type of procedure, and that decreases the risk of infection in the endocardium. If a patient does present with infective endocarditis, you are primarily going to see fever, positive blood cultures, and other symptoms related to the infection. Now let's talk about myocarditis. Myocarditis would be the inflammation of that myocardium or the actual muscle. So this really thick muscly area. Cardiomyopathy is usually the cause of myocarditis. Inflammatory cardiomyopathy is the result of an infection. Now, at the end of this map, we're going to talk about cardiomyopathy that is not the result of inflammation or infection. But myocarditis is an inflammatory cardiomyopathy that is caused by infection. This infection weakens the heart muscle, and because this layer here is really the heart muscle itself, it weakens the heart's ability to pump. And so you really start to see a decrease in cardiac output and ejection fraction. Infections can be caused by viruses, bacteria, or they can be parasitic in nature. Sometimes people will recover out of inflammatory cardiomyopathy, but other times they may not. In those particular cases, they may need a heart transplant or they may need some type of ventricular assist device. But really, what we end up being with in myocarditis is decreased cardiac output, decreased ejection fraction, and a very weak, flabby heart that is really not strong. Now, pericarditis is inflammation of this outer layer. This outer layer has some fluid in it that kind of helps reduce friction. Pericarditis is when that layer becomes inflamed. It can be idiopathic. We don't know why. It can just happen. It can be from infection of the pericardium, or it can be from trauma, meaning after a myocardial infarction or a heart attack, that trauma causes the inflammatory response. And remember, with inflammation, you do not always have infection. So sometimes it's related to infection and sometimes it is not. So when we have pericarditis related to post-MI, it is not related to infection, but is just from the inflammatory response from the damage to the heart muscle. Now, when patients do have pericarditis, a lot of time it is self-limited. It often resolves on its own. If there's a little bit of fluid in there, we call it a pericardial effusion, which we'll talk about in a few moments. And a lot of times that does resolve if we just give it some time. Patients may complain of some chest pain or discomfort, friction rub you may hear. They may have fever and just not feel good. This chest pain is a different type of chest pain. It is not the angina that you feel with a heart attack. It is chest discomfort. Certainly, it needs to be evaluated to make sure it's not a heart attack, but it is a little bit different than angina from ischemia. It's really just pain from inflammation. Now, let's talk about rheumatic fever. Rheumatic fever is an inflammatory disease that can affect the heart, the joint, the brain, and the skin. And usually it occurs about 1 to 5 weeks after a group A strep infection, also known as strep throat. So this little guy there is supposed to remind you that strep throat infections can result in rheumatic fever. This is not common these days in the United States because we have really good access to testing for strep throat and antibiotics to treat strep throat. However, in places where they may not have good access to care and good access to antibiotics, if left untreated, strep throat infections can develop into rheumatic fever, and that can end up damaging the heart. What happens is the strep bacteria basically tricks the body into attacking itself, causing inflammation. And that inflammation is in these center layers, the endocardium, and we start to see what we call vegetation collect on these valves. And this picture here kind of shows you that. It's really just bacteria clusters that start to infect these valves. The problem is then the valves do not close tightly and the valves start to leak. So we do have symptoms of carditis, which is inflammation of the heart, valve damage, which we just talked about. We also can have some joint pain, and we call those maybe arthralgias. That'd be a good name for it. And so we do have inflammation in those joints. We do see chorea sometimes, which is some random neurological movements. We can have some fatigue, fever, and a rash. As far as testing for rheumatic fever, we will check a titer. We'll see some antibody titers rise. We'll see an increase in sedimentation rate. We may check an echo to check for valve function and EKG testing. The outcome often can result in damage to the valve, and specifically, we see the mitral valve most often affected. Treatment will retreat that strep infection, and then we'll do some other treatments to kind of reduce the carditis and decrease the inflammation and hopefully not have some long-term effects. Now let's talk about pericardial effusion. Pericardial effusion is a buildup of fluid between the outer layers of the heart or the pericardium. This can result from infection, trauma, post-MI. It's very, very similar to pericarditis. Pericarditis actually is just inflammation, whereas pericardial effusion is the inflammation along with the buildup of the fluid. That fluid can take some time to resolve. Usually, if it's not too much, it'll just absorb back into the system. There is a concern if the buildup is large. If it gets too much, it can start to compress the heart. This pericardial effusion is usually just some type of fluid, but if you have something like a hemorrhage in this pericardial area, you can have a buildup of blood. Now, when we look at this picture here, this is kind of showing you what can happen if we get too much buildup of fluid in this pericardial sac. And this will start to compress on the heart. And that we call cardiac tamponade. Tamponade is when there is a quick and dramatic buildup of blood or an effusion in this layer of the heart. It's usually the result of a serious chest trauma, maybe a gunshot wound, and blood will build up quickly in this area and start to compress the heart, and it actually will restrict the heart from pumping and filling. So we'll have a decrease in cardiac output, and often we actually may see a systole developed or lack of a heartbeat. It is definitely an emergent condition. It's a trauma focused condition where they'll have to actually relieve that pressure by removing that blood. The last one we want to talk about is cardiomyopathy. Now, at the top, we talked about myocarditis, which was an inflammatory cardiomyopathy. But what we're going to talk about here is a non-inflammatory cardiomyopathy, which mean is not caused by an infection or inflammation. What's happening in cardiomyopathy is we just have a weakened flabby heart muscle. And in this particular case, that heart muscle just cannot pump well, and we see a big decrease in our cardiac output in patients. This right here is a picture of an echo, just kind of showing you that's what we would see. With an echo, we would use that test to show the cardiac output and what the ejection fraction is of the heart. And also we can tell if the heart is enlarged. When cardiomyopathy, the heart does become enlarged. Now, with cardiomyopathy, in most cases, when it gets very end stage, we do need a heart transplant. The heart muscle is just weak. It's not dead, but it's just so weak it cannot function. Now, the causes are dilated, where the heart muscle thins out and cannot contract. So if we have our heart here and we have our myocardium, what happens is it just gets very thinned. And this very thin muscle is not strong enough to contract. Now, hypertrophic is when it gets thicker. So if we start with this myocardium, this heart muscle here, with hypertrophic, it gets very thick. And this thickened is too bulky and it is not efficient for contraction. Also, you see reduced amount of blood that can be in that ventricle. So it has reduced a volume as well. And the last is just restrictive, where this muscle just becomes very stiff and fibrotic and can no longer contract. And those are the three causes of cardiomyopathy, non-inflammatory. And there you go, your completed map, and that wraps up our cardiac disorders. Remember to subscribe and like our videos so that you keep getting our new ones, and I hope you have a wonderful day.